All right, and last but not least, we got Sarah Briley from CPCQC. Sarah, as the Clinical Quality Improvement Program Manager, Sarah focuses on shifting evidence-based research into action by assisting Colorado hospitals in implementing emerging best practices. Sarah partners with national and state maternal health leaders to develop hospital protocols, policies, and practices, as well as education and training for medical providers to improve health outcomes. For those of you that have been involved with Chosen Quick or COAIM-SUD, Sarah is at all the meetings all the time, and she's been a real consistent kind of presence, offering both kind of strategic support as well as administrative and programmatic support. So we're very thankful of how intimately involved she's been with all the SUD-related programming.
Okay, hi everyone. I also recognize that I'm the last speaker of the day and before you can go home, so I will also try to speed up a little bit. But I'm here just to provide a couple updates regarding our behavioral health and substance use disorder programming initiatives. So just a quick overview of CPCQC. The Colorado Prenatal Care Quality Collaborative is the convener of maternal health partners from across the state, both clinical, public health, community, and policy sectors, in order to improve patient outcomes across our communities. CPCQC was also selected by the national office within the American College of Obstetricians and Gynecology to be the Alliance for Innovation on Maternal Health, or AIM, agency responsible for implementing patient safety bundles across labor and delivery units across the state. We were also designated by the CDC as the state's perinatal quality collaborative, which is part of a 50-state network. And we were also legislatively directed to track implementation of the MMRC recommendations and also quality improvement work. And then most recently, we were authorized by the new Colorado State Bill 24175 to implement and collect data on quality improvement initiatives in all birthing hospitals and NICUs across the state. So this is just an overview of where we are currently across the state. As of May 2024, we had about 70% of labor and delivery units in the state participating in one of our quality improvement initiatives, which covers about 86% of the deliveries in Colorado, or around 50,000 births. And again, this is for across our quality improvement initiatives. The first one that we would like to talk about is our Improving Perinatal Access, Coordination, and Treatment Behavioral Health, or IMPACT BH initiative, which works with Colorado communities to strengthen and integrate local perinatal mental health partnerships. We are currently, as of July of this year, in Mesa, Montrose, and Eagle counties. There are agencies within each of those counties that are funded to do this work, with the first pillar being the enhancement of diversity of community-based perinatal mental health navigation services. So again, not just those traditionally mental health providers, but we are looking at doulas, community health workers, that sort of thing. We are also expanding perinatal mood, anxiety, and substance use disorder screening, brief intervention to treatment, ESPERT across Colorado. This service and education is not just for those 3 counties, but available to all hospitals across the state. We are also working to strengthen local perinatal mental health systems through improved communication, coordination, and trust. Again, within those 3 counties, they have regular interval meetings between all these community partners that touch maternal mental health in some capacity. And then finally, we advocate for a system-level change that enhances local perinatal mental health solutions. So the focus of this initiative is to really make sure that there's a safety net around these patients, making sure that they're not falling through the cracks, making sure mental health providers and support services in the county are working together to support these families. So our big unveil this year is our Turning the Tide initiative. If you're familiar with COAIM-SUD, that initiative has been rebranded and revamped to Turning the Tide. We recognize that COAIM-SUD was not the best name. And so while we had this opportunity to change some of our programming, we also decided to change our name. And I'll get into some more of the details of that change in a couple slides. But to present some data that we have found so far this year, over 2024, we had around 5,000 patients admitted into our hospitals where they are implementing Turning the Tide or COAIM-SUD. Of those around 5,000 patients, around 4,700 were screened. And that top graph really highlights over the last 4 quarters the rates or percents of screens for SUD, which is that darker blue line, at around 96% in our most recent data. And 95% for depression screens. So again, we're doing really well with those. And we could use an improvement on anxiety screens and social determinants of health. So that'll definitely be a priority as we go into 2025. So of the 4,700 who were screened, around 78 were actually screened positive for a substance use disorder. And if you look at that bottom graph, when we look at our data from about a year ago, around 1.4% of patients admitted actually screened positive for a substance use disorder. And then Q4 of 2023, it jumped to around 3%. And most recently in Q2 of 2024, it has gone down to 1.7%. Which these numbers may seem low, but again, knowing that unintentional overdose is the second leading cause of maternal mortality across the state, we know that these numbers are actually pretty high. Some additional data points. We are really proud of our participating hospitals. We've seen an increase of about 60% in follow-up care practices. So we not only want our hospitals to implement universal screening, but we want those hospitals to then take care of those patients, have the conversations of those screening results, and connect them to resources. So that bottom left graph highlights the 4 clinical practices that we really encourage hospitals to partake in after a screen is positive. So social work consultation, scheduling that postpartum visit. Was the patient counseled on treatment services, and ultimately did they receive treatment inpatient or a referral before discharge? And we see that the majority of patients are receiving about one of those services, and that's that second red tower there, with only about 30% actually receiving 4 of those services. So again, the comprehensive piece. So going into 2025, that is also a priority for us. That top right graph looks at the naloxone care practices. So if a patient did screen positive for opioid use disorder, did they receive naloxone before they were discharged? Were they prescribed naloxone? Were they talked to and counseled on naloxone? And so we see around 67% of patients are actually receiving that naloxone before discharge. And then something very relevant to this group, plans of safe care. Only about 35% of our hospitals are reporting that they're actually conducting a plans of safe care with that patient before discharge. So there's definitely a lot of room for growth there in the next year as some of these plans are being rolled out. So looking at 2025 and turning the tide and how we are making several enhancements to COAIM SUD, this next year we will be a 1-year closed cohort that will run from January 2025 to December of next year. And we really found that hospitals wanted to learn from each other. And if we have hospitals enrolling at various times throughout the year, it's really hard for us to pair them up and learn from one another because they are coming out at different places. So that will be a closed cohort next year. And we will continue with dedicated quality improvement support. We have Roxanne, which is our quality improvement coach, and she's wonderful. So she will continue working with hospitals. And new for this next year, we will actually be releasing a new web interface where hospitals can track their progress, look at their data at any point in time, and see what's next as far as best practices. We'll also continue prioritizing SBIRT as a foundation for SUD care. Again, we can't help these patients if we don't know that they're struggling with substance use disorder. And then we will also continue with Chosen and Moms Plus integration, and those will remain elective components once hospitals have really solidified that foundation of SBIRT. And then all education offerings will remain the same. If you scan that QR code, it actually takes you to our Turning the Tide enrollment page, so you can learn about some of these changes and some key dates coming up. Going into dyadic SUD care, when I was here last time, we were trying to recruit more hospitals that could really have NICUs and LNDs start communicating and providing more dyadic care. We had 4 hospitals raise their hands, so Denver Health, PSL, St. Joe, and Good Sam. So those 4 hospitals are working with us to improve those conversations between the 2 units. And we have gone through process mapping and goal setting with them. Quite a few are already getting their Eat, Sleep, Console education. And then we have 1 who's submitting data for that dyadic care piece. A few resources. Again, these are mostly focused for labor and delivery unit teams. However, there are some great patient-facing substance use disorder handouts through the Moms Plus website. Again, if you scan that QR code, it takes you right to those resources. They have some great resources in both English and Spanish related to alcohol, stimulants, opioids, and cannabis. And because they have great work with pharmacists, they have also created some new order pathways for cannabis, stimulant, and nicotine use disorders. And then if you're interested in medications, there's also naltrexone, buprenorphine, and methadone information. And quickly, to wrap up, here are a few upcoming events that we have with CPCQC. Our final SBIRT training of the year will take place next Monday, October 28th from 5 to 7. It's a virtual training, so if you are interacting with patients at all and responsible for having these conversations, make sure you sign up for that. It is free for everyone to attend, and there are CEs available. The bottom, nurse training for stigma and bias, I think was mentioned a little bit earlier, but it's a great training for nurses who, again, interact in any capacity with these patients. It's there are small group conversations facilitated by Hard Beauty staff. So your staff have the opportunity to ask those hard questions and maybe have some uncomfortable conversations in a safe space instead of with patients. And then finally, we have our 2025 recruitment timeline and office hours, which again, with this revamp of Turning the Tide, we will be hosting 2 office hour sessions from 11 to 12 on November 13th and December 11th, where again, your teams can come learn more about these changes and ask any questions you may have. And then starting in January, we will have our 2 onboarding sessions, one January 9th and the other January 23rd. And we do ask that if hospitals are going to be joining Turning the Tide in 2025, that they are able to join one of those. And that QR code again takes you to our landing page where you can learn more about the initiative. Thank you.
All right, so much going on. Y'all made it. You are at the end. It was truly just a jam-packed day of so much learning, knowledge, and discussion. I hope it was worthwhile time spent for all of you. You feel energized to go back to wherever you all work professionally and think about how to operationalize these core pillars, interventions, approaches in your local settings. Please complete the evaluations. We do a random drawing. We'll do 2 separate drawings to win a $50 electronic Amazon gift card. So I'll give you a second to scan those. There's 2. There's an evaluation of the day. The second is if you work within a hospital, a healthcare setting, we want to know what are some of the practices happening within your setting. And so that's the second QR code on the left. So for either of those, there's a possibility that you may win a gift card. So scan those. All right, I see phones still up. All right, still scanning, still scanning. While people are scanning, let me just say, if you have any questions, just reach out to Kelly or myself. And if you are within a system that's not yet engaged with Chosen, or you're not a healthcare system, but a nonprofit organization or a community organization that has not yet been at these forums, this is your first time, but you want to learn more, please reach out to us. Our Chosen Quick Steering Committee is full of experts that have deep knowledge, and depending on your area of interest, they will come and visit you where you are. If it's really far, it might have to be by Zoom, but you will have a visit and you can get all the knowledge and experience from them. So finally, I will conclude with this slide. It's a quote from Martin Luther King Jr. that I hold dear to my heart. True peace is not merely the absence of tension, it's the presence of justice. I think at times we feel that things are relatively calm, be it personally or professionally. I know for those of us that are somewhat type A, when things are too calm, you get a little anxious anyway, because you're like, oh, something's coming. But in that moment of calm, I ask myself, is just the absence of tension enough? But really, is there justice being acted upon, being acted out? Are all the players in the room, all those that live within our society, equally represented, their voices heard, and equally served? And so I think of peace as truly the presence of justice. And with that, I would like to acknowledge all of the people involved in this work, those from Chosen Quick listed there, those from CPCQC, as well as Illuminate Colorado. I especially would like to thank Kelly Sutton, as well as Rebecca Allen, for really being in the weeds with the minutia of conference planning. It is a heavy lift, and they do it every 6 months without complaint, and I am so very thankful. Thank you, all of you, for coming. I hope you have a safe drive home. And again, please don't hesitate to reach out if you need anything at all. Thank you.